Besides the branches and cords of the brachial plexus and the axillary artery, the axilla is also having the axillary vein and 5 groups of the lymph nodes, which are 20 to 30 in number. So besides these structures, some structure can also seen during the dissection of the axilla. The axillary artery again, first part, second part is behind the pectoralis minor muscle, and third part is between the lateral margin or the lower margin of the pectoralis minor muscle up to the lower margin or lower border of the teres major muscle. So this is the third part. This vein running medially to the axillary artery is the axillary vein. So the vein, here we can see the axillary vein. This is the axillary vein up to outer border of this first rib. This is the first rib. Up to the outer border of the first rib, the name of the vein is the axillary vein. When this vein leaves the outer border of the first rib, the name of the vein is changed from axillary to the subclavian, and from this point below the lower border or lower margin of the teres major, the basilic vein and the 2 veiny committents of the axillary artery, the 1 and the second. The basilic vein, which is the post-axial vein of the upper limb, 2 veiny committents which are accompanying the axillary artery and draining the blood from the deep part or deeper parts of the forearm, hand and the arm, are converging here to form the axillary vein. Here this vein is also receiving the accompanying veins of the branches of the axillary artery. Before its termination, or changing the name from the axillary to the subclavian, it is receiving the pre-axial vein of the upper limb, the cephalic vein or the cephalic vein. The cephalic vein can drain in the terminal part of the axillary vein or inside the initial part of the subclavian vein. The axillary artery is ancillary in the axillary fascia, which is the continuation or modified part of the pre-vertebral fascia, but the vein is outside the axillary sheath, because when there is increased venous return due to some physiological like the exercise or some pathological conditions, there is expansion of the diameter of the vein. So axillary sheath is formed by tough fibrous deep fascia. prevertebral fascia. So this sheath will not allow the vein to dilate and to accommodate the increased venous return. So it is outside the axillary sheath. Now we have seen the cords and branches of the brachial plexus, the axillary artery and its branches, axillary veins and its tributaries. Now there are 5 groups of the lymph nodes: the anterior, posterior, lateral, central and apical. So there are 5 groups. Axillary artery and the axillary vein. The lateral thoracic artery is here on the lower or lateral border of the pectoralis minor muscle. So the lymphatics or lymph nodes which can be seen in relation to this lateral thoracic artery is the anterior group or pectoral group of the lymph nodes. So this part is having anterior or the pectoral group of lymph nodes, draining the lymph from the anterior wall of the trunk up to the umbilicus. There is a watershed area, the umbilicus. Above the umbilicus, these are draining in this anterior or pectoral group. Lymphatics from the afferent which are coming from the breast are also draining in this anterior or pectoral group. The tail of spans, the axillary tail of spans, sometimes confused with the lymph nodes when it is enlarged, it's also draining. Tail of spans. These lymph nodes are enlarged in breast carcinoma. The other group which is running through the line of subscapular vein is the posterior group or the scapular group. This is the posterior or the scapular group. So anterior group is pectoral, posterior group is the subscapular or scapular group, and it is draining or receiving the afferent from the posterior wall of the trunk up to iliac crest. The lateral group, also known as brachial group. This group is behind the axillary artery, axillary vein. the lateral group, also known as the brachial group. Receiving the afferents from the upper limb, from the fingers or digits, the hand proper, the forearm and the arm.